Hello, I'm Michael Pierce, and this is The Human Condition. We're talking today about why you should test for heavy metals now. I think that many people are having heavy metals and they don't know it. We're not talking about an acute exposure of heavy metals in the commercial industrial workplace sense where a person has inhaled a cloud of metals at work in a mine, or that they've drank heavy metals in a particularly dense poisoning episode, or that they've eaten something that's heavy metals and they've got a bunch of heavy metals in their blood. That's not how most people get exposed to heavy metals generally. What we know about heavy metals comes from industrial exposures just like those, where it's a big bolus, a big glum of metal exposure in one short period from almost always mining. It's from mining and metals and metallurgy. But what most people in the everyday chronic sense get heavy metal exposure from is a slow trickle. It's a drip drip, and they get it from food and water and from skin exposure and other types of things is a little bit every day for years and years. So that chronic exposure to heavy metals is a real problem. And the reason people need to do it is that most humans get rid of heavy metals pretty fast. And if you don't, you want to know. So that's one reason to do it right now. And another thing is, if you're getting chronically exposed to heavy metals and you don't know it, you will still carry a high burden of heavy metals in your hair. Most people. Now, some people are not that way. Some people actually have less heavy metals in their hair, and it's really surprising how little they have in their hair. But it's not a high number of people, but they're usually people that have some kind of genetic tendency to almost hoard heavy metals in their cells and not release them and get rid of them. It's almost like they won't give up the heavy metals and they store them deeply inside their cells. And those people have less than typical amounts of heavy metals. Now, you might wonder, what's normal heavy metals coming out of a person's hair? Why is any amount good? Well, the reason for that is we're all exposed to heavy metals every day in small amounts from the jet stream, from the oceans, from water, from air, because of volcanoes. And so we're all detoxing from heavy metals, and we all need to have a trace amount of heavy metals coming out of our bodies through our hair if we're healthy. You can do hair from the head and you can do groin hair, pubic hair. You can't do body hair or leg hair or anything like that. You can't do arm hair or chest hair. It has to be one of those two things. And we have to tell the lab what hair it is. And that hair measures about 4 months, about 120 days of exposure and expression. So it's really the best standard, according to even our government, our FDA and USDA, for chronic metal exposure. Blood is great for acute exposure of less than 9 weeks. But really that doesn't help. So blood doesn't help us mostly because most people that have chronic low-level, slow, heavy metal exposure don't have it in their blood. So going to your doctor and getting a blood test for heavy metals is not usually very useful. Although, if you think you've been exposed to heavy metals and in any capacity, it may be a good idea to get your blood checked to make sure you don't also have high metals in the blood. But if you don't have high metals in your blood, heavy metals, then it doesn't mean you're safe and it doesn't mean you're okay. You might still have to do a hair test. Now, in some people that we're trying to figure out what to do with them, we might do urine or stool testing of heavy metals, which only gives us a few hours of clearance. But that's very useful if you're really advanced in your chemistry knowledge and your doctor is working with you with particular issues like autism or problems with clearance or autoimmune disease or you're a very fragile type of patient. So most of the time, you're not going to do blood, you're not going to do urine, you're not going to do fecal testing, you're going to do mostly urine testing. There isn't really any saliva test for heavy metals. Another reason that you want to do, that we talked about before about doing heavy metals now is you're not acutely exposed, you're not a commercial worker, but you are exposed to computers. All of us are exposed to computers, all of us are exposed to industrial processing of metals, all of us are exposed to tailings where drilling has been done into metal, and that leaves the filings. Those are called filings or tailings. And anytime you grind metal, that all those heavy metals and aluminum are left to go into us. And they're also in chemtrails. I don't know whether I'm supposed to call them chemtrails or not, but I don't care. That stuff that comes out of planes is not okay. If it sticks around, it's not okay. And even if it doesn't stick around, jet fuel is not safe. That's another problem, and that's an issue we can talk about on another lecture. But in this case, when we're looking at cloud seeding and all the things that they do to try to make it rain or control the weather, that stuff is aluminum and many other heavy metals and other molecules I won't go into today. But aluminum is the one we want to worry about. Now, aluminum isn't technically a heavy metal, but it can be potentiated by glyphosate. It can be potentiated by Agent Orange, dioxin, by pesticides or herbicides. You're spraying stuff on your yard. You're spraying stuff on your garden. You're spraying stuff on your lawn. You're near a golf course. Bad news. And it's bad for your pets too, by the way. So we don't want that stuff because that stuff does many bad things for you. And aside from causing cancers, it makes aluminum go through your blood-brain barrier better. Read Stephanie Seneff's book, Toxic Legacy, about that. It's really fascinating, and lots of other sources. So if a person is normal and healthy and they're exposed to a little bit of toxic heavy metals, they're getting rid of them through sweating and through pooping and through peeing, and they're getting rid of them through their kidneys and their urine and their bile and everything, their liver, their large and small intestine, their pancreas, all that stuff. And that's helping. However, if you're getting chronically exposed and you haven't identified a source, doing a hair test for heavy metals from, say, Mosaic Lab or some other laboratory that does hair, there's a bunch of them. Doctors Data does it. I think Genova does it. All these labs do this. It's really important to find out if you're getting exposed. So these are reasons why it's good to do it now if you've never done it before, and find out if you're under chronic exposure. Because again, like a really famous Dr. William Walsh of Chicago is a biochemist who says that heavy metals are cleared really rapidly in healthy people. But if you're drinking tap water, or you're exposed to GMO foods and other types of processed foods, if you're exposed to pesticides and herbicides that carry heavy metals, if you're exposed to molds and mildews that eat heavy metals and digest heavy metals, you could be giving yourself heavy metal exposure and not knowing about it. And I'll end on saying that there's no really great test for aluminum. You can do hair for aluminum and it's worth doing, but you can't rely on it. If it's positive, great, but if it's negative, that doesn't mean you're okay. It might be a false negative, because there isn't any good test for aluminum in living humans right now. So pay attention to your use of aluminum containers and aluminum products and cans and aluminum foil and deodorants, antiperspirants rather, that have aluminum in them for antiperspirants and all the different exposures to aluminum. Assume that you have it and consider doing a test for heavy metals right now.